Ikaw ang tanging kayamanan at pag-asa ng ating bayan. Sa man larangan, nakikilala, hinahangaan ng buong mundo. Hayaang umusbong at hayaang lumaya, lumipad at sumama sa tagumpay. Ang galing ng everyone, ang galing ng everyone. Kaya ko, kaya mo, ang bawat pagsubok. Tututangin ang kagalingan ng Pinoy. Iba ang lahing Pilipino, maaasahan at mapagmahal, matatalino at may prinsipyo, handang lumaban sa anumang laban. Hayaang umusbong at hayaang umaya, lumipad at sumama sa tagumpay. Ang galing ng everyone, ang galing ng everyone. Kaya ko, kaya mo, ang bawat pagsubok. Tututangin ang kagalingan ng Pinoy. Hayaang umusbong at hayaang lumaya, lumipad at sumama sa tagumpay. Ang galing ng everyone, ang galing ng everyone. Kaya ko, kaya mo, ang bawat pagsubok. Tututangin ang kagalingan ng Pinoy.
The Philippines is home to over 108 million Filipinos. Among them, the world has seen the best singers, dancers, athletes, and the brightest minds, artists and speakers. But the Philippines is also home to earthquakes, volcano eruptions, and almost 20 tropical cyclones every year. In spite of everything, the Filipino people has continued to rise above it all. Because in moments where it counts the most, there you will find the Filipino people, united as one. We are as diverse as the many, many islands that form our country. But one thing will always hold true. The Filipino spirit shines for everyone. Because galing ng one is galing ng everyone.
In Getz Pharma, we believe that to care for the future generations, we have to go green and lead. Leadership in Energy and Environmental Design is the most distinguished program of the U.S. Green Building Council for the design, construction, maintenance, and operations of high-performance green buildings. It has 4 rating levels, and the greener and more sustainable the building is, the higher credit points and certification rating it will receive. Estola, the newest manufacturing plant of Getz Pharma, has been awarded with the highest rating, LEED Platinum, certifying Estola as truly a green building, the first in the whole of South Asia. With sustainable engineering solutions, Estola's LEED Platinum certification means it has met the highest sustainability credits in all categories. That's why Gets Pharma takes the lead to lead. We lead to lead by investing in innovative solutions to care for people's health, while we also invest in innovative solutions to care for the environment. By using energy-efficient equipment and smart lights, we reduced energy consumption by 42%. And having one of the largest solar-powered systems by a private sector, we make use of renewable energy, consequently reducing our carbon footprint. The efficient use of smart water fixtures and reusing treated wastewater for flushing reduced our potable water consumption considerably. At Gets Pharma, we installed bicycle areas to encourage low-carbon transportation. We also promote mental comfort by improving available open spaces, and even planted 7,000 indigenous trees and shrubs to help reduce heat and air pollution levels. In Estola, waste management is strictly followed, so we reuse and recycle, helping save our environment and the community. By adopting sustainable practices, we at Gets Pharma promote living a green life, protecting and preserving our environment, while also caring and protecting the welfare of our employees and the economic well-being of the community we operate in.
Building our new factory, which we call Project Estola, very aptly named after Estola, one of the most beautiful wetlands in the world. We made the bold, big vision, and we said we will comply with the platinum. Our project team worked very hard. When we set up the vision, it was essentially consciousness, I believe, that we should care for our future generations. We should leave a better world.
To build a better future, we must start today. Gets Pharma has taken that step forward to go green and take the lead to lead a brighter and healthier future for the next generation. Let's take the lead to lead for a better world.
Ang galing ng everyone, ang galing ng everyone. Kaya ko, kaya mo, ang bawat pagsubok, utami ang kagalingan ng Pinoy. Hayaang umusbong at hayaang lumaya, lumipad at sumama sa tagumpay. Ang galing ng everyone, ang galing ng everyone. Kaya ko, kaya mo, ang bawat pagsubok, utami ang kagalingan ng Pinoy. Ikaw ang tanging kayamanan at pag-asa ng ating bayan. Sa man larangan, nakikilala, hinahangaan ng buong mundo. Hayaang umustong at hayaang umaya, lumipad at sumama sa tagumpay. Ang galing ng everyone, ang galing ng everyone. Kaya ko, kaya mo, ang bawat pagsubok. Bukod kami ang kagalingan ng Pinoy. Iba ang lahing Pilipino, maaasahan at mapagmahal, matatalino at may prinsipyo, handang lumaban sa anumang laban. Hayaang umustong at hayaang umaya, lumipad at sumama sa tagumpay. Ang galing ng everyone, ang galing ng everyone.
Magandang gabi po sa lahat ng ating mga viewers. Live na live po tayo ngayon dito sa Galing ng Everyone, where we talk about goodness, wellness, and excellence for each and every Filipino. Ako si Zach and I am part of the Galing ng Everyone team powered by Gets Pharma. Sobrang napapanood ang ating diskusyon ngayong gabi dahil pag-uusapan natin ang tungkol sa bakuna para sa mga bata. Safe nga ba ito? Ito ay ating tatalakayin kasama ang ating mga guests ngayong gabi, at kung kayo ay may mga katanungan, isulat niyo lang po sa ating live chat at ito po ay susubukang sagutin ng ating guest doctor. Pero bago ko po ipasa sa ating moderator, magkakaroon po tayo ng isang laro para sa lahat ng ating live viewers. Kung kayo po ay nanonood ngayon, pwede kayo mag-join para sa chance magkaroon ng premyo. Ang ating game ay tinatawag na Guess the Jumbled Word. So ito po yung mga kailangan gawin upang maka-join. Okay, so meron po tayong jumbled words. May 5 tayong jumbled words related to health or kalusugan. At ito ay ifa-flash on screen. So a picture is also included as a clue. So ang kailangan nyo lang gawin is to write the word in the live chat of the Galing ng Everyone Facebook page. If that is correct, get the chance to win a share treats prize. So there will be 5 winners that will be announced at the end of the show. A viewer can only win once during the show. So ano po yung prize natin? Each winner will receive a meal voucher via share treats. And winners will be messaged after the program with the code to be sent via SMS. So ready na po lahat sa ating Guess the Jumbled Word? So just write your comment kung alam nyo po ang tamang sagot. Okay guys, so let us start. Ready na ba? Okay, ito ang ating unang jumbled word. Okay, so meron tayong matanda na kasama rito. Ano kaya ito? Inap. It's just a 4-letter jumbled word. Kung alam nyo po ang ating sagot, all you have to do is to comment down below kung alam nyo po. Okay? And we're seeing a lot of comments. So, later on, after the end of the show, lahat ng we'll be choosing one of those who have the correct answers. Okay? So, mukhang marami na po nakasagot at ito po ay pipiliin later on. So, ang tamang sagot po ay pain. Okay? Tungkol sa this jumbled word is pain. And guys, if you want to know more about pain, kung may gusto kayong malaman about rayuma, sakit sa kasukasuan, meron po tayong No Pain No Gain Facebook page. So just search it. Yan po ay powered by Gets Pharma. And tayo rin po ay nag-o-offer ng free medical consultation sa page na yon. Okay, ito na yung next jumbled word. Ready na po ba lahat? Okay, so our next jumbled word is, ito, may bata at may hawak siya. Ano kaya ito? Samat. Okay, samat. Ano kaya ito? Ang word na to. At mukha siyang may hawak na blue na device. Ano kaya itong jumbled word na to? Okay, put your answers. Okay, and ayan, may mga answers na tayo and tama kayo. The right answer is asthma. Okay, sa lahat ng mga sumagot ng asthma, one of you gets a chance to win a prize later on. Okay, sa ating third question, third jumbled word, eto, sad bite. O nga pala, before we go there, if you want to know more about Hika or allergies about asthma, we have the Laban Lungs Facebook page. Okay, ito yung next sa ating jumbled words. We have sad bite. Ano kaya itong na to? May ini-injection rin siya. Okay, diabetes. Okay, and tama. Ang ating tamang sagot ay diabetes. And if you want to know more about diabetes, we have sugar beet PH. Okay, just search it. Sugar beet is also powered by Gets Pharma. Okay, ito na yung fourth jumbled word natin. Ano kaya ang jumbled word natin? Next jumbled word. Ito, may hawak siya. Mac host. Ano kaya itong jumbled word na to? Okay, if you know the answer, all you have to do is to write the correct answer. Ito, meron pang may parang mascot pa rito. Ano kaya ito? Okay, may nakakuha na kaya? And yes, ang tama po nating sagot ay stomach. Okay, stomach. So if you have concerns or if you want to know more about GERD, about acid-related disorders, about dyspepsia, we have Living a Green Life PH. And ito na po, ang final chance na magkaroon ng prize, we have, ito, ano kaya ito? Appetitis. Ano kaya ang jumbled word na to? And meron siyang may icon rin. Liver ata ito liver. Okay, what is the jumbled word? All you have to do is write your answers on the live chat. And ito, may mga sumasagot na po. At ang tamang sagot po ay hepatitis. And if you want to know more about hepatitis, meron rin po tayong disease-related page for that, and that is Be Viral PH. Okay, so maraming salamat po sa lahat ng mga sumali. Ang winners po ay i-announce natin after the main discussion. So at this point, gusto ko po tawagin ang ating moderator. Okay, ipakita natin. Okay, ang ating moderator, Dr. Angel Gonzales. Doctora, the floor is yours.
Thank you, Zach. Thank you for that wonderful games. Medyo nahirapan yata ako doon. So anyway, welcome everyone for the live webinar again for ang galing ng everyone. Of course, we are webcasting live via Facebook, our Facebook page. So tonight, this is of course powered by Gets Pharma, but tonight we will be discussing all about COVID-19 vaccine para sa mga adolescents o para sa mga pediatrics. Okay, I'm also a pedia, but we invited an expert about sa Bakuna and sa Bata, of course, and celebrity mom who is also equal famous. So we'll be calling her tonight. But before everything else, I would like to inform everyone na ito po ay isang webinar about sa bakuna para sagutin ang ating mga agam-agam about sa bakuna ng mga bata for COVID-19. Wala pong bakunang binibenta or produkto ang Gets Pharma. This is just a public service information for the general public to know about or to be aware about the COVID-19 vaccine. So, without much further ado, allow me to call in our celebrity guest for tonight. She is, of course, an award-winning television host and producer. She is a best-selling author and creative entrepreneur, author of a self-named blog at www.daphne.ph, which has been nominated as top celebrity and style blog in the Philippines. She is also a former independent producer with the celebrated design show The Urban Zone. And she wrote a best-selling book, Chic, Tips on Lifestyle and Work, published by Summit Publishing, and one of the country's most credible digital influencers and the recent ambassador of AirAsia for 2 years and host of AirAsia's Red Talks. She is also conferred as Goodwill Ambassadress of UNICEF Philippines in 2019 after having been appointed to UNICEF as Special Advocate for Children since 2010. So bagay na bagay po sa ating topic for tonight, let us call on Miss Daphne Osena-Paez. Hi, Miss Daphne.
Hi, Doc Angel. Thanks for having me, and thank you for that nice introduction.
Thank you so much for guesting our webinar for tonight.
Oh,
so
of course, the topic is very, very significant.
I know, it's a very hot topic actually. In fact, we have a lot of questions already from the page. Okay, so Miss Daphne, allow me to introduce our expert for tonight. She's an infectious disease pediatrician. Okay, she is from Cardinal Santos Medical Center and an active consultant there. She's the head section of pediatric infectious disease at present, and a member of the research committee of Cardinal Santos Medical Center. She is also a member of the COVID-19 TAG at the emergency room and member of COVID-19 vaccine task force. And actually, she has a very robust CV. So she is from the RITM as well, or the Research Institute for Tropical Medicine, and a medical specialist there. She's a consultant of the medical department and training officer of pediatrics infectious diseases. She's the head of RITM COVID-19 vaccination program, so she's been quite busy lately, and the research program lead for dengue and other arboviruses, and member of the rabies research group. She graduated from the UERM, and she's currently a member of the Antimicrobial Stewardship Committee of the University of Perpetual Health Delta and member of Infection Control Committee. Let us all welcome Dr. Maria Tricia Subido-Carino. Hi, Dr. Trish. Good evening.
Hi, Dr. Angel. Hi, Miss Daphne. So thank you very much for that kind introduction.
Yeah, so Dr. will be tackling a very hot topic for tonight. It's about COVID vaccine. I believe it is the National Vaccination Days when is it again? November 29 to December 1, right?
Yes, so nakakatapos lang ang ating National Vaccination Days. That was November 29 and to December 1. And And I think magkakaroon pa uli ng National Vaccination Days, December 15 to 17.
So meron ulit. So Dr. Talking about the COVID vaccine, no, para sa mga bata or age 12 to 17 years old. Tama ba? 12 to 17 years old.
Yes.
Ito po ba okay lang sa mga bata or pasyenteng may comorbidities like may asthma, cardiac problems, or meron akong kilala na nagtatanong na merong trisomy or Down syndrome yung anak niya. Is it okay? Or ano po ba yung mga comorbidities na kinoconsider natin for the vaccination?
Sige. So, dun muna tayo sa COVID in children. So, just summary lang of COVID in children. So, ang COVID, it also happens in children, di ba? So, in fact, in the Philippines, less than 13% of cases natin, less than 13% of cases are in the pediatric age group. So, yung mga nagkakaroon ng COVID na pedia, it accounts for 13% of cases sa Pinas. And ang case fatality rate sa mga bata ay less than 2%. And sa mga bata, pwedeng tong usually mild ito. Actually, majority of cases are mild, but we do see moderate cases and severe disease. And meron din tayo na tinatawag natin na mga complications ng COVID like yung ating MISC na tinatawag na multi-system inflammatory syndrome in children with COVID. And sa mga batang nagkakaroon ng COVID, meron din tayong tinatawag na long COVID in children. Now, ang question is yung tungkol sa mga batang may comorbidity. So, safe ba silang bigyan ng bakuna or nararapat ba silang bigyan ng bakuna? Actually, yung isa sa mga rasyonale ng pagbigay ng vaccine or ang pediatric vaccination rollout natin ay because ang mga bata or mga pediatric age group na may medical conditions or comorbidity ay they are at higher risk for having severe disease. So, or mas maraming mga batang may comorbidities na nagkakaroon ng COVID. So, in general, as compared to those children na walang comorbidity. So, ano-ano ba itong mga comorbidities na to? So, yung tulad ng sabi mo, yung may Down syndrome, kasama yan, genetic conditions, medical complexity, yung mga naka-tracheostomy tube. So aside from that, yung mga may neurologic conditions, diabetes, mga metabolic diseases, and ano pa ba, yung ating obesity. So emphasize natin yung obesity. Obesity, ito yung tinatawag natin may body mass index na more than 95%. So usually, di ba, ang mga pedya, mahilig sila mag-plot doon sa growth chart. Kapag above 95%, yun yung ating mga obese. So emphasize natin na actually ang mga obesity as a comorbidity, and actually obese children are at 3 times higher risk of having severe COVID than non-obese children. So nakita natin ito. So kuwari mga na-admit namin sa ospital, marami kaming mas maraming na-admit na COVID patients na obese kesa sa hindi obese na nagsisevere disease. But again usually sa bata, ang COVID, usually mild lang siya. But merong mga ilan na na-admit dahil may severe disease nga sila and yun nga, nagkaka-complication. So, ang pediatric rollout nga natin, ang pediatric with comorbidities, nasa A3 na sila So, priority group sila. So, yeah, in general, ang mga vaccines natin against COVID are safe and effective, and for comorbidities, kung wari may asthma yung anak nyo, may obese yung anak nyo, mas lalong kailangan silang mabakunahan.
Doc, before we go on, I have a question. We all know that since COVID started, that the kids were not really getting sick or getting severely ill. That's why nauna yung mga people with mga elderly, and then people with comorbidities. But now we're in this phase na children naman, no? But you mentioned that not all kids will be getting severe illnesses from COVID. But why is it important to vaccinate children between 12 and 18 right now?
Yeah, so the importance of vaccinating children 12 to 18 is first, so we can achieve yung herd immunity. Actually, nung lumabas ang Delta, di ba, it's highly infectious. So parang yung threshold natin for herd immunity, dapat at least maka-reach tayo ng 90% of the population na 80 to 90% na vaccinate natin. And if you see the statistics, children, those less than 18 and below, they account for like 38 or almost 40% of the population. So, hindi natin to ma-achieve without them. And of course, so yung mga may comorbidities, higher risk sila of having COVID infection, higher risk din sila of dying from COVID, and we don't want that to happen.
So even those with no comorbidity,
Yes,
kailangan
yes.
din magpabakuna.
Yes, even those with no comorbidities, we want to vaccinate them, of course, to protect everyone. And we know naman that the vaccines are safe and effective. So that's it.
Okay, Doktora, since sinabi nyo nga na pwedeng yung mga walang comorbidities or para mag-serve ng herd immunity, no? Maka-form tayo ng herd immunity. But what are those brands? Diba? Nagiging ano na ngayon, kung anong brand yung nakuha mong bakuna. What are the brands that are approved for this age group, yung mga bata, 12 to 17 years old?
Okay, so sa Philippines, we only have as of now or to this date, we only have 2 vaccines who were granted EUA or emergency use authorization by our FDA, so Food and Drug Administration, and those the vaccines are the Moderna and the Pfizer vaccine. So pareho silang approved for use in the pediatric population, 12 to 17. So ngayon, doon pa lang tayo sa adolescents, 12 to 17.
Doc, I remember, kasi I have 3 kids. One is 18, she's already abroad. And then my 12-year-old and my 15. So nung nag-open yung last month or a month and a half ago, nung nag-open tayo dito for vaccination for 12 and up, maaga ko sila ni-register dahil may mga asthma talaga sila. So, natapos na kami. So, I'm very grateful talaga to everyone who made all of this happen. But just for our audience here, ano yung mga requirements na kailangan before going to the vaccination site?
So, thank you for that question, Daphne. It's good to know that your kids are already vaccinated. Yeah. So, that's one step towards the end of the pandemic, vaccinating almost everyone, right? So, ano yung mga requirements natin para mabakunahan ng ating anak? So, ang mga requirements natin, of course, kailangan yung mga adolescents natin na 12 to 17 years old ay may kasamang guardian or parent. So, aside from that, kailangan ng ID kung meron yung bata, pwede rin yun, at ID ng parent. At importante, meron tayong documents showing filiation. So ito, ano tong documents na showing filiation? Ito yung birth certificate or baptismal certificate. So ito, nakasulat dito. So pwedeng original copy or certified true copy ng birth certificate issued by the PSA. And kung wala namang PSA issued na birth certificate pa, meron naman tayong mga documents na pwedeng gamitin like baptismal certificate or school ID ng bata. Basta nakalagay din doon yung name ng parent kasi siya yung kasama. Tapos pwede rin yung PhilHealth or SSS or GSIS ng parent. Basta nakalagay doon yung pangalan ng bata.
Okay, Dr. Trish, sorry, Ms. Daphne, you have a question?
Go ahead.
Yeah. In case na yung mom or yung parents wala dito sa Pilipinas, guardian yung kasama, kailangan pa ba ng consent ng magulang? Kunwari, hindi na in touch yung guardian with the parents. Kasi may mga cases na ganun.
Sige. So, sa mga cases na ganun, actually, may nilabas kasi na parang operational guidelines on the rollout of pediatric vaccination, and may mga rules sila doon. And sinabi doon na in the event na wala ang parents, kunwari nasa OFW, tapos ang guardian nila dito ay yung lola or yung tito, kailangan lang sila mag-SPA yung special power of attorney na
Power.
apostilled and kung pwedeng ma-approve ng consul doon. So medyo mahirap din. Pero
Oo nga
kasama
eh.
yun. So may ganun na in the event na gano'n. Pero kung wala talaga yung parents, the parents passed away na, we follow yung family code na yung lolo, yung lola.
Next of kin.
Immediate relative.
What
Yes,
about
Miss Daphne.
how about like so the day we talked about the requirements, yung mga kids with comorbidities, I know that they need some kind of certification from their pediatrician, right?
Yes,
Do
that's
they
right.
get that
So,
from their own pedia or doon na mismo sa DOH pag sa
Yeah.
site na?
yeah, they can get it from their pediatricians or any
Okay.
hospital. So there's a form by the DOH na na the pedia they have to fill it up at yun yung i-represent. Ito ay para lang doon sa mga ito yung form na yon. So medical certification for COVID-19 pediatric vaccination para sa may mga comorbidities. Ito manggagaling sa doctor nila. Ito po para lang dun sa mga may comorbidities. Para dun sa rest of the pediatric population, hindi na po kailangan ng clearance from your pediatricians or from your family doctors.
That's great.
Okay. So,
Okay.
any other questions, Miss Daphne?
Yeah, well,
Yeah.
let's say that the kids already got vaccinated. I know a lot of parents here are concerned na ano ang may expect after being vaccinated. Ako, meron din ako mga concerns kasi yung effect sa akin ng vaccine ko, yung second dose, medyo nanginig ako. Pero I knew it was an expected side effect. It wasn't like out of the ordinary. Kasi naman, nung panahon natin, they were giving us a list of what to expect. So for kids, ganun din ba, Doc?
Yeah, so for adolescents or for children, almost all vaccines is same naman, di ba? Pwedeng mamaga, mamasa, or mamula yung area na pinagturukan. So that's pain, redness, and swelling. And you can have systemic symptoms like panghihina, sakit na ulo, sakit sa katawan, lagnat. So that's expected side effects and it goes away in 1 to 2 days. So so you just give supportive therapy.
What I found on the site was the DOH and the hospital staff were very, very helpful. Talagang kinausap yung mga adult supervisor, kami, mga parents, and inisa-isa yung mga expected na, tapos may number pa kaming tatawagan after kung kunyari may fever, anong igagawin. Pero luckily with my kids, wala naman. Yung ano lang yung normal na medyo masakit lang dito. After a day, they were fine. So it was really, it was a pleasant experience for them.
That's good, Miss Daphne. I'll ask lang din, Miss Daphne, from your part, no? Kasi you're representing the general public, no? Kasi kami, Dr. Tricia, we're both doctors, so we know what to expect, di ba? Like me, ako mismo nagbakuna sa kids ko eh. I did not have hesitations. So I did not have hesitations. Pero from your end ba, before mo pa-vaccine yung kids, did you have like second thoughts? Like coming from, di ba, ang daming posts sa social media and all.
Yeah, no, I didn't have second thoughts. In fact, I wanted it done right away. My family lives in Canada. So, syempre, nauna sila. Yung mga nephews ko, they had it ready, like, I don't know, in June pa lang, meron na sila. So, they already went back to school. So, yung akin, yung motivation ko naman, gusto ko sana makabalik na yung mga bata sa school. And this is one of the factors that can really affect the reopening of schools. And we're seeing that now. The DepEd is talking about opening schools safely. So hindi ako nag-hesitate. I was very, very excited about it. And syempre, ang biggest concern namin when COVID started was our kids kasi meron silang asthma. So ang daming unknown pa at the time. So when this was already made available, talagang excited ako magpabakuna sila. Sana ganun din sa iba. Sana ang mga nanonood natin na audience ay wag naman mag-hesitate dahil this is based on scientific fact and ang dami ng studies na nagagawa rin. Wag kayo matakot na kasi bago lang siya. I mean, madami na tayong we've already gotten a lot of vaccines through our lifetime, even nung bata pa tayo, di ba?
Exactly. And marami ng mga sakit na eradicate dahil sa bakuna, di ba? Yes. And siguro, Dr. Trish, do we have studies to support para sa mga bakuna na to? Like what you've mentioned a while ago, sina Moderna, sina Pfizer.
Yes, oo, madami ng studies and clinical trials na nagawa. Bago naman yan i-roll out and bago yan i-approve for EUA, dumaan na yan ng mga clinical trials. And as I said, like in the US na, more than 1 billion na vaccinate nila, di ba, ng COVID vaccines. And it has been proven to be safe and effective. Okay, so I think we really have to educate people more and to at least wag na sila maging hesitant in vaccinating their children.
Yes, that's the very purpose of this webinar. Kasi yun nga, marami pong nagtatanong bakit ganyan or maraming nagpo-post sa social media against the vaccine. So again, just to reiterate, hindi po namin kayo pinipilit, hindi po to sapiltan. This is just to give you enlightenment about the vaccine. So there, yes, Miss Daphne, you have any other questions?
Yeah. You mentioned yung mga nababasa online. Ako kasi, nung sa gitna ng pandemic, in-edit out ko na yung mga confusing and, unverified chismis. I really just stuck to the DOH and the WHO and UNICEF, of course. Pero nababasa ko rin yung mga ibang news and may nabasa rin ako na parang some people are concerned about, will this affect fertility of the child when the child becomes an adult?
All right. So there's no data on COVID vaccines and infertility, and there's no evidence that any vaccines, actually, including COVID vaccines, can cause fertility problems in men or women. So actually, ini-emphasize nga ng mga medical organizations na there's no evidence that COVID-19 vaccination causes loss of fertility. So so yun nga, parang fake news lang to or hindi natin alam, di ba? So it's good that like Miss Daphne, ang talagang doon tayo nakatutok like sa WHO, sa DOH, sa CDC, and sa mga talagang reliable source. So that's it.
Yeah. Dr. Trish, kasi one of the issues there, no, sa bakunahan, sasabihin nila meron kasing consent form and dissent form. Bakit daw naggaganon? Baka daw kasi hindi natin alam yung ine-expect na outcome later sa bakuna.
Yes, actually, yung ating consent form, it's a way of us knowing na nakinig talaga kayo sa health education, di ba? Alam nyo ang benefits and risks ng vaccination, at nag-sign kayo dahil nakinig kayo nga dun sa health education ng doctor na andon or healthcare worker na andon nung ini-inform nila kayo tungkol sa benefits and risk of having the COVID vaccine. And sa pag-sign nyo doon, it says na alam nyo ang benefits nito at alam nyo rin ang risk, although rare lang siya.
Okay. Yes, Miss Daphne?
Okay. Maybe hopefully that our audience is appreciating these snippets from Dr. Tricia, no? But maybe we could get specific. What are the benefits of being vaccinated?
Yeah, so for the benefits of vaccination, of course, children can get infected with COVID, they get sick from COVID, they can get complications from COVID, and they can transmit COVID to others. Okay, so for the benefits, vaccinating children like adolescents, kasi hindi pa tayo dito sa Philippines, we're not yet vaccinating the 5 to 11, the 6 months to 5, hindi pa natin sila nababakunahan. By vaccinating the adolescents, their kuyas, their ates, it's like we're already protecting also their siblings who are not yet eligible for vaccination. And of course, yung pinaka-benefit talaga ng vaccination natin ay it can protect from COVID infection. It can protect from severe COVID and hospitalization. It can prevent and protect us from complications of COVID, like yung ating sinasabing multi-system inflammatory syndrome in children with COVID and long COVID. And it can protect against death from COVID. It can also help in reducing community transmission and faster return for us to the pre-pandemic pace and activity. And of course, it can benefit for our economic stability.
Wow.
Okay, that's good to know, Dr. No? But have you ever encountered yung mga like adverse effects o yung mga side effects na sinasabi? Ano yung pinakagrabe na nakita niyo so far?
Okay, so ano-ano ba yung mga doon muna tayo sa contraindications, no? Hindi pa natin na discuss ano pinaka contraindication natin sa Pfizer or Moderna or mRNA vaccine. So, ang contraindication natin is yung may mga allergies sa PEG, yung mga polyethylene glycol, and yung mga nagka-anaphylaxis sa first dose ng Pfizer or ng Moderna. So, with me saying that, it's saying na merong ilan, pero konti pa lang parang rare pa din na nagkaka-anaphylaxis. Pero rare pa rin siya. I think, ano naman whenever there's a side effect or SAE ang tawag namin na severe adverse event following immunization, nire-report ito sa ating regional adverse event following immunization committee, the RAIFIC. So, that's why, di ba, pagka na-vaccinate kayo, binibigyan kayo ng number, dito kayo mag-message kung meron kayo naramdaman, or talagang nire-report natin yan. Kasi nga, these vaccines are relatively new, and we want to know yung mga ganyang rare adverse reactions. And for mRNA vaccines, meron tayong yung tinatawag na myocarditis and pericarditis. But let me tell you na myocarditis and pericarditis is a rare adverse event following COVID vaccines, but it can also happen with other viral infections, with other viral infections, and it's usually ano naman siya, parang supportive lang ang treatment, and kumbaga mas mataas pa ang risk mo of having pericarditis and myocarditis with COVID infection than with being given like COVID vaccines. Parang nasa 16 times higher pa. So yung mga patients natin with COVID, mas mataas ang risk nila of having myocarditis, pericarditis. So how do we prevent that? Of course, through vaccination.
Okay, there was a question a while ago, Dr. Trish. Good evening po. Okay, pwede ba na mag-vaccine ng may heart problem? Sakto dun sa myocarditis.
Yes, yung may heart problem, basta meron kayong clearance from your doctor.
The cardio.
Sa ano ha? Yeah, oo. Dun sa for pediatrics ang pinag-usapan.
Okay.
Actually, I just wanted to also... Oh, sorry. Go ahead.
No, it's okay, Daphne. We can answer that later on.
Yung nagkataon lang kasi, Doc, nung nag-open up na safely the alert level here, wala pa yung COVID for children for 12 to 17. Inuna ko yung mga vaccines na for a year and a half hindi nagawa ng kids ko, because like Doc Angel, you asked me if I had any hesitations. I'm the kind of mom na may libro ako and talagang lahat ng vaccines ganon. So nung nag-COVID, we were not able to resume our regular pediatrician visits and things like that. So meron a few vaccines na hindi ko na update. So nung by like August, September when it opened up, I went to the pedia and had my kids vaccinated for flu and like polio booster and things like that. All the, in the chart. So I did a follow-up. Tapos biglang naging COVID vaccine was available. And then they said you have to wait. Was there a window that you have to wait? Although my pedia said that the kind of vaccine that they got, walang waiting period. So they got it also after like a week later. So that month, ang dami nilang vaccines.
Good question, Miss Daphne. O nga, Dr. Trish, time frame.
Yeah,
From
so
other
for ang time frame natin dyan is 2 weeks actually. It's 2 weeks
2
kasi
weeks.
yun yung nasa natin nasa ating DOH screening
Mhm.
list. Dapat at least 2 weeks. So actually pwede siyang on the same day or 2 weeks ang interval natin. But
Right.
yun nga, siguro your doctor said na pwede anytime kasi in the US, ganun ang kanilang
Oo.
that's their
Different type daw.
recommendations. Yeah, parang sa kanila, kahit it doesn't matter yung interval. Pero dito sa atin, 2 weeks ang sinet ng ating Department of Health with regards to interval of other vaccination, like for example, flu vaccine or any other vaccines and the COVID vaccines. 2 weeks ang ating interval.
Right. While you have me here, maybe I could speak as a mother to other fellow parents
Yes.
here that are watching. Hindi lang COVID-19 vaccine ang kailangan ng mga bata. Like, i-review ninyo yung record ng mga anak ninyo at try to catch up also. Tapos alam ko na ang mga LGU ay may libreng bakuna for the mandatory or the prescribed ones from 0 to 5. Pero yung mga older ones may konting bayad na. I don't know how much it is in the other hospitals. Pero yung mga measles, polio, 'di ba? Yan ang mga mga preventable diseases na pwedeng anuhin ng vaccine. So sana sama-sama tayong lahat, pati yung tuberculosis, lahat na.
Tama, Miss Daphne, no? O nga, Dr. Trish, how can they still go on with their vaccines? Na wala naman yung
wala namang problem with so thank you Miss Daphne, no? So you're championing immunization kasi talagang sa Philippine Pediatric Society and the Pediatric Infectious Disease Society of the Philippines, we really advocate vaccination, not lang the COVID vaccine but the other vaccinations like what we said, diba, the polio, the measles, MMR, pneumococcal vaccines, flu vaccines, a lot of vaccines. So please make sure that your the kids' vaccines are up to date, so you can contact your pediatricians or go to the nearest health center to have them update the vaccination of your child. Now, just remember na if they're gonna get a COVID vaccine, make sure na there's a 2-week interval before and after. Before the first dose and after the second dose.
Tama, libre naman sa mga health centers yung di ba, required the vaccines. So
Yes.
Thank you for raising that, Miss Daphne. Tapos, there was a question a while ago, I think. Is it, kung primary complex ba ay tinuturing na comorbidity?
Yes. Kasama ang primary complex is tuberculosis, pulmonary tuberculosis. It's also a comorbidity.
Ano lang natin, ang comorbidity ay merong kaakibat na sakit ang isang pasyente.
Yes.
Okay, so I think there are other questions from our viewers. Let me read. Ayan. Good evening, ilang weeks or month na pwede magpa-vaccine ng isang bata na last week lang siya nag-allergy or namantal yung katawan niya. Yung parang sinabi ni Miss Daphne, ano ba yung interval dapat after one vaccine? Ito naman, paano kung nagkapantal or nagka-allergic reaction sa food, let's say gano'n?
Wala naman tayong recommendations on that, but kung wala na siyang allergy, pwede na siya magpabakuna. Yeah, may screening naman tayo screen kayo ng doctors doon Of course, pag may symptoms ka, may fever ka, cough, colds, any symptoms, i-defer yung vaccination mo. Kung may allergy ka that day, usually nagde-defer din kami. Kasi we won't know if your allergy is due to yung existing allergy mo or due to the COVID vaccine.
Okay, Dr. Trish, there are pediatricians naman doon sa vaccination site. Like me, I'm one of those pedia who stay in the vaccination site. No? And question, like example, my daughter, parang kay Miss Daphne, wala siyang doubts, pero I have this question also in mind kasi nakagat siya ng dog, so nagpa-anti-rabies ako sa kanya. Pero may human immunoglobulin. How long dapat yung 2 weeks pa rin ba pag age?
Pag merong nilabas na guideline dyan ang Department of Health na if it's like rabies vaccine, tetanus vaccine, walang fina-follow na interval. Anytime. Yes.
Anytime pwede. Paano yung may mga hika, yung may mga asthma, naka-steroid sila?
Yung mga, kung inhaled steroids, okay lang naman yon. But, di ba meron tayong doon sa last part ng screening checklist na yung mga may immunocompromising conditions. So, ano yung immunocompromising conditions? Pag naka-steroids kayo, naka-prolonged steroid use. So, that's more than 20 milligram per day for more than 2 weeks or more than 2 milligram per kilogram per day for more than 2 weeks. Alam siguro yun ng kanilang mga doctors. Yeah, prolonged steroid use tayo. Hindi yung inhaled steroids, hindi kasama yun. Oral, systemic, yes.
Oral meaning iniinom, no? Ang inhaled, yung mga nasa salbutamol, mga inhaled na steroids like dexamethasone. Yan, yung mga nakapuff.
Ganyan.
And Dr. Trish, I know someone na nagka-Guillain-Barré. Yung father, yes, after vaccine. But we don't exactly know kung post-viral yun kasi nagka-flu yung dad. And then, pwede bang maka-receive ng bakuna ngayon yung mga anak niya?
Yung mga anak niya?
Yes, yung mga
naman. Yes, oo na. Yes, pwede naman yung mga anak niya. Kasi yung GBS niya is due to the vaccine ba? Or the viral infection? Hindi
naman alam kasi apparently he received the vaccine a month or 6 weeks bago siya nagka-GBS, nagka-Guillain-Barré. So hindi mo masabi if it's a vaccine related or not. Pero nagka-flu siya. Probably it's still a viral related, no? Post-viral pa din.
Sige, wala naman siya sa mga contraindications. Family history of GBS. Yeah.
Okay, so is there a threat sa pagbabakuna ngayon na with the coming of the Omicron variant?
Yeah, so like what threat are you talking about?
Yung,
like what?
Let's say, like si Moderna last night nag-release, di ba, na baka their vaccine will not be able to cover or baka ma-downplay yung effect ng bakuna nila because of the Omicron. So are we seeing na kailangan ulit ng another 4th shot for those na naka-booster shots na, di ba, nag-roll out na ng booster Di ba? So are we seeing that na magkakaroon ulit ng another shot, yung ganon?
Yeah, parang ako hindi ko pa masasagot yan. So siguro only time will tell, di ba? Kung ano ba talaga ang magiging, but the Omicron kasi pure potential pa lang di ba? Potential for increased transmissibility, potential na decrease ang antibodies against the di ba yung vaccine efficacy. So parang potential pa lang siya now. So I think we still have to wait and see kung ano ang magiging effect ng Omicron sa ating vaccine. But all the vaccines will, against any variant, it will protect against severe disease and hospitalization and death. Yes.
All right. So ibig sabihin nung it will prevent going into the severe case, hindi ka masyadong magiging grabe, no? Yung magiging effect ng COVID sa'yo pag nabakunahan ka. Right. Okay, yes, Ms. You're saying?
Whose primary responsibility is it to have the kids vaccinated? It's the parents, right? Pero nakakatulong din ang mga school. Kasi sa school ng anak ko, nag-issue sila ng guidelines and nagtutulong sila kung paano mag-register. So parang pag nagtutulungan ang communities, you know what I mean? I guess that's the whole concept of bakuna, anong tawag doon? Bayanihan, bakunahan.
Yes,
so,
yes.
Talagang magtulungan tayo na ipa-register lahat na ng mga bata na 12 and up para tuloy-tuloy na, para safe na rin yung Pasko natin, di ba? Tapos maybe by next year, maka-school na sila.
Yes, I agree, no? Yung experience ng mga bata na they're going to school normal, yung ganon, yung wala tayong kinakatakutan pag nakabakuna na. Do you agree with that? Both of you, I guess. I need your reactions.
Yeah, so kasi ako like Dr. Angel, di ba, bata pa yung kid ko, like magpo-4 pa
Yeah.
lang siya. So talagang online pa lang talagang alam niya. If you ask her na, "Pero you wanna go to school?" "No, I only go to school in the house." So parang ganun
Oh.
sila,
Di
hindi
ba?
hindi oo, sa house lang daw sila nagso-school. So hindi pa
Mm.
sila masyadong aware sa like kayo nga, swerte kayo, your kids, you're vaccinated na, pero kami na may mga less than 5 years old pa, wala pa silang vaccine. And we're hoping na soon magka-vaccine na rin para sa kanila.
Mm. For me, I think like it's become, kasi akin 12, 15, 18. So medyo affected talaga sila. It's really part of their growing up years. But I think this by being vaccinated and with the possibility of seeing their friends again and going to school and interacting, there's nothing like it. I mean, education and learning will be a bit better when there's face-to-face because there's going to be social interaction. Pero I think importante din na alam ng mga bata at ng mga magulang na it's vaccines and minimum health protocols. Like, kailangan pa rin mag-mask, di ba? Tapos kailangan pa rin conscious na kasi ang dami pa nating hindi alam. So, I don't think na dapat super 100% confident tayo na dahil bakunado na tayo ay lahat na you know what I mean? Dapat meron pa ring concern sa safety.
Yes. I agree, no? Parang dapat maging way of life na rin natin yan, no? Parang like us in the medical field, Dr. Tricia, no? It's a habit that we spray alcohol and we wash our hands every other patient or each time we hold sa chart ng pasyente or ng staff sa hospital, no? Or even pag naghawak kami ng ballpen, we do that. So sana ganun din in general public. We make it a point na it's a way of life, yung hygienic measures. Tama si Miss Daphne, no? And yeah, Dr. Trish, are you seeing na yung level 2 na to? Kasi we are expecting again, baka mamaya may wave, no, by December kasi nag-holidays like last year. What happened? Are you foreseeing ba na from the medical field na mukha bang magtutuloy-tuloy yung level 2 natin or mada-downgrade pa ba tayo to level 1 ba or ma-upgrade ulit sa level 3 ganun? What do you think?
Of course, we're hoping for, di ba, the best, di ba? So, ngayon kasi we're okay. Parang, like, if you ask me, hanggang, like, first week of October, ang dami pa naming admissions, di ba? Although, konti lang sa mga bata, but we had COVID admissions. But ngayon, halos wala na. Like, mga 3 weeks na walang COVID in some of the hospitals. Pababa na talaga. And I hope na tuloy-tuloy na hindi lang kung makontrol natin. And I think kung ma-vaccinate natin ang target population, di ba, it will be a safer Philippines. And, we're gonna have the kids will be in a better place. And mas mapapacilitate yung pag-open up ng schools and yung balik natin sa pre-pandemic phase kung babalik pa tayo. But of course, again, we have to adhere to the minimum public health standards like masking, physical distancing, di ba, and hand washing.
A question to Miss Daphne, no? Given the level 2 na natin for the public, are you like you for a layperson, let's say, you're part of the non-medical, are you still afraid or scared to go to the clinics of your physician to get consult? Yung ganun.
No. No, because it's so important to have, especially well, for me, because I try to be a responsible adult and a responsible parent. I have to be okay. My husband and I have to know how we're doing para we could take care of our children. So, nung kung kailan possible, nagpa-check up na ako ng aking like annual. Of course, nung October, annual mammogram because it's Breast Cancer Awareness Month. Tapos yung mga bata, yun, in-update ko rin yung mga records nila. So, sana, dahil I think ang pinaka-safe ay ang hospital dahil lahat ng mga nandun ay sanay na sa pinagdaanan na to, right? I've asked my friends that na parang, oh, it's the hospital is safe now. You can come and have your checkups. So sana we take this time to follow up and figure out how we stand in our health. Kasi naman, I'm also a believer na hindi lang naman vaccine ang solusyon. Pag kunyari may problem ka sa weight mo, may magagawa ka naman eh. Pwede ka namang mag-exercise. Pwede kang kumain ng mas healthy para you help yourself also get better. It's not just the vaccine. There's so many things that we could do to keep our minds and our body healthy so we could all move forward and be together again.
I agree, no? It's not just, siguro this pandemic also taught us to modify our lifestyle, no? Be a healthier person. So, not just our body, but given the lockdown situation, pati mental health natin, napansin na, di ba? Yeah.
Oo nga.
So, Miss Daphne, you're a UNICEF ambassadress, I believe, right? Are there any programs from UNICEF with the situation right now, especially for the children?
Well, yeah. Well, UNICEF is a partner of the Philippine government through the DOH and the DSWD and other government agencies in dealing with emergencies such as this. So I know that the vaccines were procured with UNICEF's in partnership with UNICEF and the DOH, and also maybe, well, if people can go to UNICEF Philippines, it's all there. We have a lot of ongoing programs for children all throughout the year. But this year specifically is very, very important because it's the 75th anniversary of UNICEF in the Philippines. So, UNICEF, the United Nations and the Philippines was part of the founding members of the UN, and they were here after the war. So maybe I could just briefly point out that in 1948, the Philippines had a big immunization drive with the help of UNICEF. And in the 50s, they had a big tuberculosis and other contagious diseases that they did, they inoculated all the children in the Philippines. So hindi bago ang vaccines dito sa Philippines at saka sa UNICEF. Matagal nang ginagawa yan. Tapos nung 1970s, meron ding program on tetanus, tuberculosis, polio. And by the 2000s, we saw polio being eradicated. Pero bumalik siya like 2 years ago dito sa Pilipinas dahil kulang na naman, hindi na na-vaccinate yung mga bata. Tapos, I remember we had a polio awareness drive just before the pandemic. And because of that, nawala na naman yung polio. So, vaccines really work. Vaccines save lives. So, I think we should not just rely on government and agencies to do it for us. We as parents, as adults, should play a role in being aware of vaccine preventable diseases because it really does save lives.
Yes, agree, Miss Daphne. That's a good one. Kasi yun yung ang daming fallacies about especially sa social media. Dr. Tricia, in connection with that, di ba, would you agree na a lot of diseases has been eradicated because of the vaccine, di ba? Like, pag meron man nagka-outbreak before, like measles, it's because hindi na pabakunahan yung anak. Am I right, Dr. Tricia?
Yes, tama yun. Like, yung sinabi ni Miss Daphne, like, I think that was 2016, yung nagkaroon na naman ng polio. And then, just like, I think last year or early this year, okay na naman tayo, na-eradicate na naman natin ang polio dito sa Philippines. We're polio-free. And nagkaroon din tayo, I think 2014, nagka-measles outbreak din tayo. Diba? It's because of, again, vaccine hesitancy. Ang daming hindi nagpapa-vaccine. So, dito sa Pilipinas, as I tell my patients, talagang we really have to update our vaccinations kasi like ako, I'm in RIT and when we still see like mga vaccine preventable diseases like tetanus, like pertussis, diphtheria, hindi mo na yan makikita sa ibang bansa pero dito sa Pilipinas nakikita pa rin siya. And parang there's vaccination naman. It's free naman in the health centers. You can get it naman in the private clinic. So very, very important talagang vaccination as it saves lives and it's to prevent vaccine preventable diseases and more.
Yun. So tama, hindi rason ng accessibility ng bakuna, 'di ba? And but Dr. Trish, what can you say about dun sa mga nagpo-post kasi sa social media na may microchip daw yung siguro i-bust natin yung policies, no? May
Oh my
microchip daw
gosh.
yung mga bakuna after mong bakunahan. Yung ganon.
Yeah, oo. So, I think, dapat talaga, if magbabasa tayo, parang let's not waste time reading yung mga wala talagang, doon tayo,
Basehan, no?
yeah, oo, doon tayo sa mga talagang, like WHO, DOH, talagang may, yeah, you know, yung talagang, totoo yung sinasabi. Huwag tayong maniniwala sa mga sabi-sabi or sa mga theories ng iba. Parang everything naman is evidence-based,
Mhm.
diba? So let's look for evidence lagi.
Miss Daphne, do you have other questions before I go on to my last?
No, I just want to take this time to say thank you because napakaganda ng programa na ganito na we can talk about the realities of vaccines like from an expert, and like thank you for inviting me as just as a mom, like in sharing my own experience. So yun lang, thank you talaga.
Thank you rin, Miss Daphne. And of course, I wanted to have legit people to talk with me about the vaccine kasi very controversial to. In fact, before we started this webinar, sa page pa lang ang daming positive and negative questions na nakuha namin. We had to filter it out and piliin. So, ayun. And one last question, Dr. Trish, is it okay na mag-offer ng mga bakuna and COVID-19 ang mga schools?
What do you mean na sila yung I think
They offer it. Like, yes, okay.
Yeah, I think through kasi ngayon DOH is the one giving out, 'di ba? If they can help naman, why not, 'di ba? Para mas ramp up natin yung ating immunization and mas ma-reach natin yung goal natin na vaccinate ng 80 to 90% of our target population.
Okay, thank you for that. Dr. Trish, one very last talaga. Nasa na ba tayo sa vaccination rate natin?
Parang yung sa vaccination rate natin, alam ko marami tayong nabakunahan sa etong National Vaccination Days. But the exact figures, I don't know yet. But what I know is that like marami na tayong na vaccinate na. Parang I think nasa 90 to 95 na sa A1, 50% sa mga A1, mga healthcare workers, ganyan. And then sa ating mga A2 seniors, nasa 58 or basta about 50% na. That's why nag-open up na nga rin tayo for the rest of the pediatric population. So,
Okay, that's good to know. So it's very enlightening, especially now mag-booster shot na rin ako, Dr. Tricia and Miss Daphne.
Wow. Yes.
Yeah, and I'll be injecting vaccines to my kids as well over the weekend. So anyway, thank you so much, Miss Daphne, for guesting for tonight's webinar. And Dr. Tricia, I know you're so busy as well. Thank you so much. And this will be a very good clarifications for our audience, no? For those who did not have their vaccines yet, it will be a good information for them. So we have a lot who logged in for tonight, and I thank you both for guesting this webinar. Thank you so much, and we're going back to Zach, my partner. I would like to thank us also pala Mr. Zach Darwin for doing this webinar with me. It won't be possible if not because of him, and of course Miss Batsheba Culpo for connecting me to Miss Daphne. And Dr. Tricia, Miss Daphne, thank you so much. Until next time, baka it will be another round, no, before the next round of national vaccination. So
Thank you again. Bye.
Thank you, everyone. Okay.
Bye.
Thank you.
So, thank you,
Thank you,
Dr.
galing ng
Angel.
everyone.
Thank you, Dr. Angel. And of course, thank you to our guests, Miss Daphne Osena-Paez and Dr. Tricia Carino. I hope our audience has learned a lot about this topic. So ngayon naman, i-announce na po namin ang winners ng ating Guess the Jumbled Word contest earlier. So ang mga nanalo natin, ito na, ipa-flash na po natin. Okay. So our winners, so yung, there were a lot who answered right, pero ang mga napili po ay sila Nurse Nina for pain. For asthma, we have Tom Tom Valencia. For diabetes, we have Emmet Anthony Villafania. For stomach, we have Joy Reyes. And for hepatitis, we have Hema Sri Divya. So we will be messaging you for your prize. Okay. And kami rin po dito sa Gets Pharma ay nagbibigay ng serbisyo para sa mga nangangailangan ng konsultasyong medikal through our social media pages. So, if you have high blood, if you're diabetic, or kung mataas ang inyong cholesterol, meron po kaming libreng online medical check-up hatid ng Sugar Beat Facebook page. Also, if you have asthma, allergies, or kahit na anumang sakit sa baga, you can also visit our Laban Lungs for Laban Lungs para sa'yo. This is also a free teleconsultation every Tuesday and Friday sa first 20 patients sa Laban Lungs Facebook page. And kung kayo po ay nakakaramdam ng rayuma, sakit sa kasukasuan, magpakonsulta na rin. We also have No Pain, No Gain. We have free consultations, free medical consultations every Wednesday and Friday. We also have offerings for free medical consultations for those with hepatitis sa aming Be Viral Facebook page. And finally, if you have GERD, dyspepsia, we also have Living a Green Life PH every Tuesday and Saturday. So just send us a message to know more about our free medical consultation services. Okay, so maraming salamat po ulit sa lahat ng mga nood. Stay tuned para sa susunod nating kwentuhan. Ako ulit si Zach na nagsasabing, ang galing ng one ay galing ng everyone.
Ikaw ang tanging kayamanan at pag-asa ng ating bayan. San man larangan, nakikilala, hinahangaan ng buong mundo. Hayaang umusbong at hayaang umaya, lumipad at sumama sa tagumpay. Ang galing ng everyone, ang galing ng everyone. Kaya ko, kaya mo, ang bawat pagsubok. Bukod kami ang kagalingan ng Pinoy. Iba ang lahing Pilipino, maaasahan at mapagmahal, matatalino at may prinsipyo, handang lumaban sa anumang laban. Hayaang umusbong at hayaang umaya, lumipad at sumama sa tagumpay. Ang galing ng everyone, ang galing ng everyone. Kaya ko, kaya mo, ang bawat pagsubok. Ito kami ang kagalingan ng Pinoy. Hayaang umusbong at hayaang umaya, lumipad at sumama sa tagumpay. Ang galing ng everyone, ang galing ng everyone. Kaya ko, kaya mo ang bawat pagsubok. Ito tangi ang kagalingan ng Pinoy. Ang galing ng everyone. 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 Ang galing ng everyone.